Good evening, everybody. Good evening from K.S.Varier Ashtanga Ayurvedics Private Limited. So this is our webinar series, Ashtanga webinar series. So this time it is the 13th webinar. We have here today Dr. Karthik, whom I would be introducing soon. So before that, Ashtanga, I would ask Mr. T.R. Shashi-Varier, the Executive Director of K.S.Varier Ashtanga Ayurvedics, to give a small introduction on Ashtanga.
Thank you, Dr. Girish, for that. I extend a very warm welcome to Dr. Karthik for the presentation today. I extend my heartiest welcome to all the participants here, and more are to join us. I think in the next few minutes, more people will be joining us, I'm sure. As for Ashtanga, K.S.Varier Ashtanga Ayurvedics Private Limited was started in the year 1936 by Ayurvedic K.S.Varier, who studied in the Kochi College. So he studied with P.S.Varier as his guide, and he went on to complete his course in Kochi in 1933 and joined and came to Trichy to start his own concern called Ashtanga Ayurveda Shala with a very minimal effort and with very zestful life. He started his career as a physician in Trichy. Starting from his home as a kitchen to make medicines. It went on to grow. Today we are an institution, so we market our products all over South. We are trying to move northwards also with our products. We have clinics in Trichy. We have 4 clinics in Trichy where we give our expertise. Then we have online consulting, and we have products which are ranging about 300 in number. We have products which are of proprietary in nature, classical products which are from the classical texts of Ayurveda. Then we have also Ayurveda related or herb related foods that are very commonly used today in the market. So we have a range of products that can be used by physicians all over. So this is a short introduction. We have a team of people here. We have 6 doctors at present in our team. And the management team is also active. I'm sure the management team is also joined here. My MD has joined. My the director of clinical side also has joined. Dr. K.S.Varier is here. So we have a team. Shortly, the session is going to start. So please wait for the session. We are going to conduct similar programs once in a month. So please be with us. Over to Dr. K.S.Varier.
Thank you, Mr. Shashi-Varier. So that was a good introduction on Ashtanga. We are very delighted by the response we received so far for our Ayurvedic webinar series. And the first webinar of 2021 from us is scheduled today. That is, we are expecting a lot more people to join in because I have seen a lot of registrations done. It is mostly because the link is, they're just getting into the link. Dr. Karthik Nandakumar, B.A.M.S, M.S, IU and M.Sc Yoga, founder of Procto Healing-complete Ano-Rectal clinic, is the person, the esteemed guest who is here. So the topic here is common anorectal diseases and its Ayurvedic management. Dr. Karthik Nandakumar, founder Procto Healing-complete Ano-Rectal clinic, is based in Kochi, having completed his graduation from S.D.M.College of Ayurveda and Hospital, Hassan, and post-graduation in Shalya Tantra, Ayurvedic Surgery from Amrutha School of Ayurveda, Kollam. Apart from being the founder of a clinic, he is working as a consultant at Sarathy Ayurveda Hospital, Aluva, Kochi. He is specialized in anorectal diseases and in Ayurvedic Marma therapy for orthopedic disorders as well. We are glad to have him as the speaker for the webinar to share his experience and guide us on very systematic approach in treating these diseases, anorectal diseases. So I am also honored to say that Dr. Karthik is my classmate in my undergraduation, and we have been associated with each other for a long time now. Very happy to have you here, Dr. Karthik. So I know that we have a very good history together. So Ashtanga is also very proud to have you here, Dr. Karthik.
Thank you, Dr. Girish. Thank you all the team of Ashtanga for giving me a chance to share some knowledge.
First I'm checking, then I'm making nuggets.
Like the main part of the health. We can tell it's the main part of the health.
Yes, doctor.
Okay, so I'll
one minute, doctor. So I'll just give the basic instructions here. Excuse me for that. All of you, it is good that if you can all put yourselves on mute. Videos can be opened. That's not an issue. Any queries or questions you have, you can put in the chat box. So which can be addressed at the end of the session. The session would be roughly around 20 to 30 minutes. And the session, as I told you, the topic is on Ano-Rectal disorders, which is very successfully treated in Ayurveda. And I would suggest that any interruptions in between is better if it is not done, because questions will be surely addressed by Dr. Karthik, and every doctor here can also have a say if they need to. So because this is an interactive session here, and it is also open for everybody, so it is not just among doctors, it is for the common people as well. So thank you in advance for adhering to the rules. Yes, Dr. Karthik, over to you.
Yeah. Okay, now I'll share my screen. All can see, right?
Yes, doctor.
Yeah. Okay. Thank you, Girish. So I'll start with the topic, the anorectal diseases. Like I'm going to take you through the modern part and also the Ayurvedic part, and the treatment, what we can do, the Ayurveda faculty, what we can do in this anorectal diseases. We all know in the field of surgery, the commonest problem faced by the patient is the anorectal diseases. Nobody is ready to tell what they have. So I think the patients, they are ashamed of exploring that. Usually the piles, fissure, fistula, most of the anorectal cases. There are many options available for this treatment, both in modern and both in Ayurveda. So one should go on with the particular treatment and for the particular disease. So some when you go to some clinic, like as a patient, when you go to some clinic, and if you tell that I got some problem while defecation, so they will blindly tell, okay, take this medicine. It's the wrong way of treatment in this case. So now in this we focus on Ayurveda, like Ayurveda Samhita give more importance to the anorectal diseases. And then coming to the introduction, most of the people know about the anorectal diseases. They are like piles, fistula, fissure, rectal prolapse, some rectal abscess, all these things. It's mainly the cause of this diseases mainly because of our postures and what habit we are having. So in Ayurveda, Sushrula had mentioned this, like in case of in Ashtanga, like it's the piles. Arivat Pranina Shrunodi. That means it's harmful like an enemy. So from this sentence, what Sushrula told, we can make into a conclusion that it's very dangerous disease. We have to treat it correctly with the correct treatment, if we go for Ayurveda, we have a lot of treatment which can correct these conditions. And various treatment modalities described by Ayurveda as well as modern science. But while treating various conditions in this disease, one should consider a particular modality and particular situation for the patient. Like mainly in Ayurveda, they explained about the Samhitas, they explained Karthika and Bhagantara. So we have to go through each disease and what is the cause of the disease, and we have to treat the disease. Not in a vague idea we can treat all the disease. So each disease have different treatment modalities. So we have to go through that. So this is just an idea. I'll tell you the patient, how the patient used to come to my clinic. They will sit, they'll come for a consultation. They'll tell the main things. Doctor, I'm getting pain during defecation. So then we can ask, is that is bleeding? What type of pain we can ask? It's a thrombing pain. It's a the pain, long-lasting pain or something. We can ask about that. Then they will tell some people, some patients. They will tell while defecation, getting some blood stains. So in like when in this condition, bleeding per rectum condition, we have to discuss on two things. Like when you go for the fissure condition, the bleeding is different. And when you go for the piles condition or fistula condition, the bleeding is different. And some they will tell pus discharge. Some will tell, sir, doctor, something is coming out, some mass is coming out during the defecation. And some may tell anal itching will be there, swelling, mucus discharge. These things, what we are getting as the symptoms, the patient will tell to us, this sort of things are happening. So with this symptom, we have to go further. So why I kept this picture means, you can see the rectum and the anus, okay? I'm talking about the anal diseases. So this is the intestine. From all this, the disease is coming till the down part. You can see the anus is the down. So what we are eating, from there it will start. How our body is, from there it will start, and the disease will end to the end point, that is the anus. These are some of the common anal problems, like acute constipation. It may be acute or chronic. Then some congenital problem will be there for some condition during the child, like baby. They may have some congenital problems. Maybe the anal verge will be small and it's very difficult for passing the stool, and some anal stenosis will be there. Then the main condition, around 80 to 90% of the condition, like piles, fissure in ano, fistula in ano, rectal prolapse, and pilonidal sinus. These are the main, 80% of the patient may have these conditions, and the carcinoma, rectal polyp and all, it is only some like 10 to 20% people having the carcinoma of anus and all. Okay, but all these conditions can lead to the carcinoma of this kind. So one have to look into all the condition, and when the doctor have to examine what is there, what is the problem. Then only we have to give the treatment, and the patient have to tell, this is my problem, doctor. Don't get shy while talking with the doctor for visiting the doctor. Then I'll go with some modern science, what they are telling and how they are treating. So first we'll go with the piles, and it will be external and the internal piles will be there. So maybe the internal piles are covered by the mucous membrane, and the external piles, or it can be called as hemorrhoids, are covered by skin. So usually when you go to talk with the patient will tell, sir, I'm getting a mass out of my anal region while defecation. So we can ask how it is the mass, if bleeding is there or not. We have to see. That is that we can call as the external hemorrhoids. It will be always the outside, and the internal mass will be inside the anal canal. And you can see some stages. The internal hemorrhoids, how they are classified, right? They have 4 stages. First stage is the internal piles will be inside only. It won't come out. In the second stage, like it will come not fully, and it will go its own. And the third stage, the pile must come out during the defecation, and we have to, with manually or with using using the finger, we have to insert it inside. And the fourth stage, the internal pile mass, it's almost outside and it won't go back. And the treatment goes like, first we have to, I told what we are eating from the mouth, and it will start. Okay, the treatment will start from the what we are eating. So we have to do the lifestyle modification, what diet we are having. Like usually the people used to take more red meat with the spicy things and all. Obviously it will cause some problem during the defecation. And so we have to take care from the lifestyle modification. So when we change the lifestyle, it may, not fully, it may reduce the disease symptoms. And some injection therapy they mentioned, and elastic bandaging, like we use called rubber band ligation and all. It is there. It's the same scenario I'll explain in the Ayurveda also. Then surgery, then the cutting out of the pile mass, that's the hemorrhoectomy we can do. Then coming to the anal abscess. This is one of the important disease surrounded the anal region. From this disease, it can cause to, it may lead to the fistula in ano condition. This is an infected cavity which is filled with pus. 90% of the abscess are the result of any acute infection in the internal glands of the anus. It may be bacterial, fungal, or some foreign matters inside. This all may cause to an abscess. So the treatment is surgical drainage. We have to cut open the abscess, and we have to drain the pus, what is there, infected pus, what is there present. It can be done in both ways. Like it's an OP procedure and also an OT procedure. In OP, we can do a local anesthesia and we can clear it out. And when you go to OT procedure, they will give deeper anesthesia and we can do the surgery. Coming to the fistula in ano, why I told anal abscess, because from anal abscess you can it may convert to, I told it may convert to fistula in ano. Fistula in ano means a tract. Just think about a tract. See, in this only I just explained, this occurs in up to 40% of the patient with previous or current anal abscess. So first the abscess will form, then it get infected, and it penetrate inside, and it may cause a fistula. It's a tunnel connecting a clogged gland inside the anal canal to the outside skin. So you can see the upper diagram. You can see the diagram. In that you can see the anal fistula. So outside the anal opening, we'll get a tract is formed from the anywhere from the buttocks, and it will form inside the anal canal. Right? Normally the symptoms like pain, swelling, and in some condition bleeding will be present. And this tract, it can go anywhere and anyhow. We don't know how it goes. We don't have a specific tract. So once I was working with one doctor, we got a patient like the fistula is opening near the calf muscles. So it was a long tract. It just went on searching, probing, and we got it open near the calf muscles. So we can't tell how it goes. And the types of fistula also I just explained. Mainly in the sphinges, okay, the submucosal, intrasphincteric, transsphincteric, supra, and extra. These are the types of fistula usually we can see. Then the conservative management for this is like breaking the cycle of hard stool. Hard stool means when the stools are more hard, it may cause a painful defecation, and it may lead to some bleeding, some some abrasions over the anal areas. And you can have adequate fluid, fiber-rich food. Okay, right? and the medical therapy like some topical agents like injection, calcium channel blockers, and surgical management we can do. Then the main is internal sphincterotomy. We have to cut open the tract and we have to keep it for the healing. Then coming to the fissure in ano. Coming to the fissure in ano. So you can see a small cut or tear in the lining of the anus. It will be outside near the anal verge. So it will be a small cut. So maybe usually when the patient used to tell, it's very painful. Doctor, I am having a wound over there. So while defecation, I'm getting my stool is mixed with some dot or a strip of blood. I can see some strip of blood over there. So in this condition, this is the condition where that is the fissure in ano. It's a painful condition. See, the crack in the skin causes severe pain and bright red bleeding during and after bowel movements. It's not a serious condition, but if somebody with a piles or somebody with a fistula, if they are having this fissure also, the pain and the intensity of the disease will be more. And usually it can be seen in some children, like the constipation is more over that age group, children age group. So usually it can be seen in young children and infants. What we can do is soften the stool. So some laxative we can give for softening the stool, drink more fluid, like taking fiber-rich foods. Then one more, the best treatment is we have to do a sitz bath. Sitz bath means we can make a vessel and we can put some hot water in that, warm water, and we can add some salt and some medicines, and we can sit for 20 minutes twice a day, and some topical ointment for pain relief we can apply. Then coming to the pilonidal sinus, it is also called the G-driver syndrome. It's a small hole or tunnel in the skin at the top of the buttocks where they divide. It's called the cleft, where we all can make it out. Like above the buttocks area, the two buttocks, in between that, we are getting a cleft. That area, we used to get some sinus opening. It's why it's called Jeep drivers means usually the Jeep drivers used to sit because of the hair follicle which is pressing inside. It may cause some infection over there, and this condition can be seen. And the pain will be there, swelling will be there, and sometimes pus will be there. The treatment is incision and drainage, wide excision and open healing, and some endoscopic ablations for pilonidal sinus can be done. Then what all these things is, we are now changing all the things to Ayurveda side. So coming to the Ayurvedic management of anorectal disease. So first, Shushruta, they are the pioneers of Shushruta. Almost all the cases Shushruta explained very well in the Samhitas. According to Vagbhatta, swelling in the anal canal which obstructs anal canal and it troubles the patient, like, and already I explained the introduction. This is in which vitiated dosha along with recta collect in the major vessels in the body and goes to his anal canal and create a swelling. This is called, this is the definition by Sushuddha. Then Sushuddha says it's a common in patients who are having mandakni, poor digestive power, because if the food is not digested properly, it may convert to hard stool. Once in a while, it's not a problem. As always, they are passing a hard stool, like a constipation, passing a hard stool. It may convert this condition to a piles, Abscess condition. So Sushrita, first he explained about the treatment should given like an Beshja, only the oral medicine, because why the oral medicine, why he, as he is a surgeon, he explained why the oral medicine. First we have to treat from the origin. So to increase the digestive power, we have to take some medicine and we have to do all the medications to make to relieve the constipation condition. And Abscess, we all know, is Shushka and Ardha Abscess. And Vata Kafaja, the dosha is Vata Kafaja, Dadu, it is Rakta, and Mala, obviously it's near the anal region, it's Purusha Mala. And Chigilsa is Vadani Romana, Rekta Shodana, Kafa Chigilsa can be done. And some conditions like in some Shushka and Ardha, Shushka Chiriluadi, Kashayam, Arogyavardhini, Kangayana Gulika, Trifala, Gulika, and all. Avarishta all can be given in Ardashas, Pravala Vasvam, Kamadurdarasam, Kudajarishtam. This all can be given. And also Sushrita has mentioned four. Only Sushrita mentioned the fourth type of treatment, like based on the Beshja, oral medicine, Shara, Alkali, Agni, like a cautery, and the Shastra, operative management. Coming to the Beshja, if the condition is a new origin, having less involvement of dosha, having less symptoms, we can go for the Beshja, like medicine we can do. The Wagbatak is telling like Agni of the patient is very important in Ashas, Adisara and Grahini disease, as there are interdependent diseases. I already explained what we are eating, how we come to our stomach, and what is the digestion about. So we have to go with the Mandagni condition. Agni, we have to clear the Agni. Agni is one of the most important part of our body, and the Agni can change our body as it wishes. So if it is treated from the root, like from the Agni, so it is very easy for the treatment of the Abscess or the Ano-Rectal diseases from the Sthana. And one should differentiate the bleeding. It will be bleeding piles and non-bleeding piles will be there. And non-bleeding piles, Balladaka, the treatment with Balladaka we can do. And Vatsaga is used for the bleeding piles. Takra is one of the most important choice in Abscess. It normalizes the vitiated dosha and also increase the bela of the patient. So we used to tell our patients like you have to take almost like I explained about the intake of water, fluid. Like I used to tell my patients like they have to take 4 liters of fluid daily, like 3 liters water and 1 liter of buttermilk. And Sushrita also explained some Panchakarma in Vada Dosha Pradhana Abscess and Virejana in Pitta Dosha and Rakta Dosha. Pitta and Rakta move hand on hand, and Shundi and Kuleta on Kapha Pradhana Abscess. Charaga explained Abhyanga, Sweda, Duma, Avagaha, Leba, Rekta Moshna, Divana, Pajana, Nilomana, all these things Charaga explained. Then coming to the here you can see Beshaja, then Chara, then Agni, then Shastra. Then now we are going to the Shara Karma. What is the Shara Karma? In piles which are soft, wide and deep should be treated by Shara. So Shara in this Abscess, usually we used to do the Shara in Vada, Kafaja and Pitta Rektaja Abscess. Then how the procedure is done? So it can't be done to all. So one should be Belavan doing this. So the patient should be Belavan. Then we have to make them into a proper position of the patient should be done. And we have to apply the, now we are using the proctoscope, then the half proctoscope is there. So we used to insert that, and we used to do the Shara Karma, and we have to apply the Shara, and we have to count for 100 matras, and also we have to see the color of the pile mass. When we are applying, we have to do the counting. Simultaneously, we have to see the color. The pile mass will be Pakwa Jambu Bhanam. It would look like the Pakka Jambu color. And when all the signs are achieved, all the color and everything is achieved, wash with kani or some lime juice or something we can use. So after the treatment, patient should be advised to take proper diet and treatment, and the treatment should be repeated after 7 days if required. Sometimes if it is a small mass, it may go, or if it is a big one, we have to do it after 7 days. And coming to the third one, treatment by Agni Chikitsa, the cauterization, which is rough, immovable, and big and hard. This is the condition. The other one is which is soft, because with Shara we can remove the soft one, and with the Agni we have to work on with the rough one, the big and the hard one. And that is why the Kapha Pradhana pile should be treated with Agni Karma. Then coming to the surgery, Shastra Karma, operative method, which is small. Tanumula, which is having small tanumula and elevated. In this condition, as I mentioned, to excise such piles with the help of instrument and should be cauterized immediately. Why it should be cauterized? Because the pile mass is always filled with blood. So when we are removing by Shastra or something, if we incise it and if we take it, cut it and take it out, the bleeding will be more. So that time we have to do the cautery to stop the bleeding. Then coming to the Bhagandhara, and the dosha is Pitta Kapha, Dhatu is Rasa-Rakta, Mala is Purusha and Klayada. And the Chikitsa will go with Malanuromana, Rekta Shodhana, Vrana Robana, Vrana Shodhana, Agni Vardhaga. Chikitsa should be done according to the Acharyas. They told Agni Vardhaga. In all the conditions they explained about the Agni Vardhaga conditions. And as it's a wound, we can go for the Vrana Robana and Vrana Shodhana Chikitsa. The treatment modalities includes Panchakarma, Shara Sutra, Shara Karma, Agni Karma, and external therapies and internal medication. And the activities like maintaining the food and advice for the food and lifestyle changes. Susuda mentioned that it's a disease where they are having dharana of pubis, guda, and basti. Vakvata says in Bhagandhara, there is a pustule or swelling formation near anus within the periphery of 2 angulas, 2 fingers. So I already explained it will be opening in the buttocks area, which is away from the anal verge. And the Pura Rupa of Bhagandhara is Bhagandhara Pedaga. Already I explained the abscess. The abscess can cause to the fistula. Okay, if the abscess is seen, first we have to treat with the first 11 of the Shashti Upakramas. And Yoga Ratnagara explained Raktamosha, the bloodletting. So in some cases we used to put some Jalauga to take out the recta, the Ashuddha recta, what is present over there. And the Agni Karma can be done, and some local labor can be done. Then Sushruta, then he explained about the
Jalauka for everybody, it is the leech therapy. All must have heard about the leech therapy in Ayurvedic surgical managements. So this is one great way of introducing the leech therapy here. Thank you, doctor. So many people are curious about the leech therapy as well. So when I just heard about Jalauka, I just wanted to say that. Sorry for interrupting, doctor.
It's okay, Girish. Yeah, we can do the Jalauga treatment. The leech therapy is it's a very, very effective therapy in this almost all the Pitta Raktaja conditions. So mainly in Bhagandhara, in piles also we used to do. If the pile mass is very big, so we can do, if we are not able to do the Shara Karma or Shara Sutra, we used to do Jalauga first. Then we will take out some the vitiated blood first and will reduce the size of the pile mass, and then we will go for the Shara Karma or Shara Sutra therapy. So how Sushruta as a surgeon, he explained about the Shara Sutra. Shara Sutra is it's already explained by the modern science, like the using a thread, certain thread for tying the pile mass, and also some like some people from Bihar and all, some quacks, they used to come to our area, like usually in Kerala and all, they used to come, they'll tell we can remove piles. So many people, they go with them. So they will tell, they will put a thread and they will tie it. This is the procedure, but they are not doing in a proper way. So we are doing in a proper way, as Sushruta explained. It's a Shara Sutra. It's a sutra. It's a linen thread made with different coatings of medicines. So first, in this condition, we have to take the patient to the examination table and we have to probe. Probing means we have to, we are getting some probes. So we have to see the track where it is going. So I explained that when I was working, I got a track till in the calf muscles. So it's a big track. So we have to see where it is going, where the opening is, inside where it is opening and outside where is it opening. Okay. After the direction, after getting the direction, and we have to insert the thread through that track and we have to tie it. The procedure should be repeated till the track is fully cut. The main aim of this treatment is, I think more than I am getting the patient that already they went for some surgery and again they are getting this problem and they are coming to me for the treatment. In this condition, what is the thing means, around 90 to 95% we can give the assurance that it won't come back again. In this condition, with the Shara Sutra, once we apply the Shara Sutra and tie it, from one side it is cutting and the other side, where the cutting side, it is joining also. The other treatment, what is in the surgery, they just lay open the tract so that again the fecal matter, what we are passing out, it may come inside and it may get infected more. But in Shara Sutra, from one side it is cutting and one side it is getting cure also. So it's having a good result while doing the Shara Sutra. In case of multiple fistula at the anal, so Sushruta has advised not cut all fistulas at a time, but keep some fistula intact to prevent large wound, which will be difficult to heal. Because in some condition, we are getting some condition like we are getting 6 to 7 abscess over the area. So we have to probe each abscess and we have to see if it went for a tract, like fistula tract, or it's just simply an abscess. So the same thing is, Sushruta explained, you are not supposed to cut all the tract, and when you cut all the tract, it will be a big wound and it's very difficult to heal. So one by one we can do it. And if it is discharging fistula or to be cauterized or Shara can be applied. And when you go for the Panchakarma treatment, Mrudu Virejana and Basti can be done, because to make the fecus what is coming out, stool little more loose for the easy passage, and all these things we can do some Mrudu Virejana and Basti. And some internal medication can be taken, like Chirivilwadi, Manjishtari, Kashaya, Trifala, Gugulu, and all we can take. And this is internal medication for balance the dosha, improve digestion, improve dietary habits can be done. And the main is externally medicated sitz bath can be done. Sitz bath, I already explained about the sitz bath. So once you are applying some, you can apply Jatiya Digruda or something on the wound. So before applying that, we have to sit, we have to do the sitz bath for 20 minutes morning after the defecation and all. Then clean the area and we have to make it dry, and we have to apply the what labas or something we can apply over. Then coming to the Parikartika, and it's a fissure in ano. The Parikartika itself denotes the cutting pain. This is the condition where you are getting more pain than this is not a big issue, like it's not a major disease, but the pain of perikartika is more than all other conditions. Though nowadays perikartika is a separate disease, but in the history it was mentioned as a complication of some other disease or some Ayurvedic procedure like Basti. Like in Basti Vyapat, they explain about the perikartika. Nowadays, more patients are coming with this condition, perikartika condition. And Kashyapa has described perikartika as a complication of pregnancy, because during the pregnancy more strain, they are doing more strain. That time the skin may get a tear. See, already I explained some of the complication of procedures like Basti. Sushrita mentioned perikartika as a complication of one of the Panchakarma treatment, Basti. See, Sushrita doesn't mention directly perikartika disease, but the disease is described a disease resembling, it said, Shadaguda while defining Netra Vyavat, like Netra Vyavat of, he already explained about that. And when you coming to the type of Vadaja and Pittaja, Dosha Vada, Dadu, Resa, Rekta, Mamsa, and Shamana, Vadanilopana, Pitta, Shamaka, Chikilsa can be done. And with the Jatya, Pichu, and bandaging can be done. The main objectives of the treatment is to relieve pain, because I told you it's a cutting pain. It's a very painful condition. So first we have to do the treatment to relieve the pain, which provides relaxation of the sphincters. Sushrita has advised to treat the condition same as wound management, like subduction. It's a traumatic wound. We have to treat it like a traumatic wound. Oral medication should be prepared by Matuka, Kandakari, and all. We can do some preparation and we can use it. And coming to the Guda Brahmsha, I think this condition is very rare condition. No, not rare, then almost rare something. In my practice, I got 5 to 6 cases of Guda Brahmsha. It's acute rectal prolapse condition. It's acute and chronic. Dosha is Vata, Dadu is Mamsa, Malapurisha. Chikilsa, what we can do is Vadanilomana, Deepana, Pachana, Lekhana, Dupana can be. And Trifela Guglu, Ayurvedic and application of Shadadada Virda externally, and can be done. In Thailand, Dupana can be done. Some Rasayana Chikilsa for this condition, we can, because it's a Mamsa Dadu, so we can, Dadu is Mamsa, so to strengthen the Mamsa Dadu, we can do some Rasayana Chikilsa also. And coming to the discussion, like various treatments are available in the present era for the anorectal condition. Each treatment is designed in order to achieve minimal complication and complete cure of the disease. Where modern science also describe operative method like fistulotomy, but with modern risk of inconvenience due to the chance of cutting your sphincters. So in the modern science also, I already mentioned about when I told about the Sharasutra, the Saturn method is same as a Sharasutra. The only major difference in modern science described to use a monofilament thread, which doesn't have any medical values, whereas Sharasutra described by Sushrita is having a medical value too. Cutting and healing both can be achieved by Sharasutra. The major principles of Ayurveda treatment is to achieve sphincter relaxation and wound healing. Coming to the conclusion, this is for the right option of treatment for anorectal disease is very important in order to avoid the complication and reoccurrence. Looking towards treatment option described by Ayurveda as well as modern science, we can conclude that many of the principles for treatment of anorectal disease like piles, fistula, and fissure are seen. But considering removing basic cause and break cycle of the pathophysiology, Ayurveda Samhita has elaborated more options in the field of anorectal diseases. So, in order to achieve the complete cure, and one should consider operative method described in Ayurveda and also the Ayurvedic medication, what the Acharyas has explained in these conditions. Thank you all. Thank you for listening.
Thank you, Dr. Karthik. So that was a wonderful session. It was a wonderful session because I can also see a few questions which are put forth. Very interesting questions that you can see. Shall I move on to the question answer session, Doctor?
Yeah, sure.
So there are some very simple queries that I can see here. First question, I also have got a few questions which came in as anonymous. So I feel the topic itself is making people want to become anonymous while questioning. So
Yeah.
some of them, they have not put it as anonymous. So one question is, in some cases, fistula and ano are healed. It will be reoccurred in other site. What may be reason for reoccurrence? How to prevent it?
Yeah, I told no. I told first we will get an abscess, then it will form to an fistula. So from outside it is healed. Maybe from inside the infection is still remaining. Okay, this is the problem. So we have to go inside and we have to treat from the inside. This is why we are using the Shara Sutra. In this condition, we are using the Shara Sutra from outside when it is tying over. So from one side it is healing and one side it is cutting. So in this condition, we can get a complete cure when you are doing the Shara Sutra therapy. And because of the infection inside, the track may again change. I already explained that we can go the track. It may go like whatever it needs, right? So wherever it want, it will go. So it may get infected and it may go some other places and it will open in some other places. There also we will get an abscess. So should I explain, if you are having multiple fistula, like multiple abscess, so you have to go with one, you have to clear with one or two, then we have to go for the other one.
Thank you, Doctor. Thank you for the answer. By that, I would like to add that participants, you will find the link for the feedback soon in the chat box put forth by my IT team. So you can put your feedback. Once you put the feedback only, you would be getting certificates within a period of 24 hours. The next question, Dr. Karthik, is what are the medications for pilonidal sinus, how to prevent, and what are the recognizing signs of the infection?
Okay, the pilonidal sinus, this is I just told usually it's happened to the people, they have more hairs, the hairy people. So the hair which is present over I already told the cleft region, when you used to sit more in a rough area, if it is not cushioned and all, it may just, the hair root may just make some infection. The root of the hair, it may get pressed and it may get infection. This is the condition what will happen. It's a painful condition. That time we have to, the main thing is we have to make it clean. That area should be always trimmed. So the hair should be removed and we have to apply some oils, like a lubricant, some oils we can apply over there.
Yes, doctor. Even in my practice, in general practice, I have seen pilonidal sinus case because the patient had not identified it as pilonidal sinus. He had come with just a recurring pain in that area, the cleft area. He was, as rightly mentioned by Dr. Karthik, he was a driver. So he's been sitting for a long time and he was very hairy as well. So the hair has turned and made a track there, thereby making a point there.
Yeah, maybe in some condition this pilonidal sinus can change your fistula track also.
Okay. Nice information, doctor. So shall I move on to the next question?
Yeah, sure.
Okay. After surgical treatment of piles, some of the patients suffer with fistula and ano. What may be the reason and what are the management for that?
See, the surgical treatment, usually the piles, they used to remove the pile masses. So maybe it may get infected. In some condition, it may again if you are, in all the condition, all the treatment first, the acharyas and all the doctors explain about the diet. So after the surgery also, we have to maintain the diet, we have to maintain the food, we have to see our acne. So when it is not maintained, it may get infected and it can cause some, it may cause to some fistula tract.
Yes, doctor. So the next question is Jaloka therapy a symptomatic treatment or is it a long-lasting root cause treatment?
It's always Jalauga therapy. In some when usually the Jalauga is used, mostly it is used in the skin condition. It should be in a particular area. If you are using it, it's a root. It can treat a root from the root. It can treat. And in condition of anorectal diseases, when we are applying the Jalauga, it's only the symptomatic treatment.
Okay.
Maximum blood it will take it out, and it can reduce the pain and the burning sensation. Everything it can reduce.
Yes, because I think the limitation here is Jaloka is a localized treatment method.
Yeah, correct.
Okay, doctor. So the next question is, could you please suggest day-to-day management of the pain and discomfort that the condition causes, especially due to unavoidable practices like sitting for long hours at work, driving, brisk walking as part of one exercise regime, and etc. So when I think the question is when these regimens are done, the patient is undergoing pain. So is there any day-to-day management of that?
Yeah, sure. Like the main thing is for the anorectal disease, we have to take care like a baby only. Take care how we are taking care of a baby, like that. We have to take care about all the diseases. When you come with like long sitting, it may cause again it will aggravate the disease condition. So one like if a patient is having any pile or fistula or fissure or something, they have to sit in a cushion chair. They can use a now it's available in internet. It's available for the pile cushion, something it's available. So or else like olden days we used to make them to sit on that auto tube, right? Auto tube. We have to we'll take it out and we used to make them to sit over that. We have to put air and we will make them to sit over there. And after 1 hour, I'll tell them to walk for a long time, and maximum they have to eat good foods, like more liquid, so that they can the stool won't get hard, so they can avoid the constipation, and it can reduce the pain and the symptoms. It won't reduce the problem, but it will reduce the symptoms what they are having.
So, doctor, as a part of that, my question is, would regular use of laxatives or regular use of, say, when we talk in Ayurveda, Vatanulomana Dravyas, would that also help?
Yeah, it will. You can't be an addicted for medicine for a long time, right? So we have to treat the disease. Laxative, it's a temporary treatment. So if one is having this is the main thing I'll tell you. All the patients they won't come, they won't tell. If somebody is having piles or some anorectal disease, they will keep mum. They won't tell to anybody. Okay, so they have to come out and they have to tell, or else they have to eat this laxative daily. They like a routine how they are eating food. They have to eat this laxatives also. For at a point of time, anyway they have to do some surgery or something. So better they have to consult with the doctor and they have to do the treatment for the root, or for some time being and for reducing the symptoms, they can have laxative or something.
Yes, doctor. I think that's a helpful comment. The next question is yoga helpful? And I just want to add another question related to yoga with this. So, Dr. Karthik, could you please suggest a few yogasanas to ease discomfort and combat piles and to keep the pain at bay? So, is yoga useful? One. The second question is, yogasanas, can you suggest?
Yeah, we can do yogasanas. Like most of the cases, if you are doing yoga, like normally, if you are doing some yogas, it will helpful. It's very helpful, like Surya Namaskara and all. If you are doing the Surya Namaskara, it will cover almost all the type of stretches and all. We can do Surya Namaskara in this condition. And these are the like stretching exercise, like hip opener exercise will be there. Hip opening exercise will be there that we can do.
Yes, doctor. Thank you. So for everybody's information, the feedback link is already given in the chat box. Please use the feedback link to give feedback. This will also help you to get your certificates. The next question, doctor, is there any workshop to learn Shara Sutra or any diploma courses? So before you answer that, I would also like to say that we are soon looking at a course with Dr. Karthik and other people as well with Ashtanga for such things in the near future. We are planning for such courses. I hope that will come to pass. Yes, Doctor.
Sure,
Please
sure,
answer.
Dr. Gish, yeah. Sir, we'll do in as a joint venture, or we can in BHU we are getting a diploma course in Chara Sutra in some colleges in Karnataka also. In I think in Hassan, S.D.M. Hassan also, they are having a 1 month or 2 month course, and we are having a 6 months course. And some good practitioners, they used to teach us without certificate. They used to teach us.
Yes, doctor. Yes, doctor. So the next question is, okay, we have a comment here. Very good presentation, Dr. Karthik. Thanking Ashtanga for organizing such informative sessions. Thank you,
Thank you
doctor.
so much. Thank
So
you.
another question, rectal prolapse management, any kind of bandha done clinically for better results, please suggest.
Yes, I already mentioned some bandaging about that. But if you do some that bandaging also, it won't be a permanent cure for that.
I think here they are asking about the pranayama bandhas.
Yeah. So we can do some pranayamas in that. I'll go through that and I'll send you the details.
Great, doctor. Great, doctor. I
Send
think
you the details.
that needs another session. Doctor can give a detail later.
Yeah, I just heard about the bandana.
Yeah. So, okay, we have another comment. Very informative session. Congratulations, Dr. Karthik and Ashtanga team. Okay, next question is, what are the main foods that flare up the condition and thereby we need to avoid?
Obviously the meat, the non-vegetarian food you have to. But now this condition in the present scenario, in the present world, the people, what they are thinking, without changing the habit, if they get some medicine, it will be okay. But it's not like that. You have to, all the cases, what I explained, the first line of treatment is the dietary change. So we have to leave non-vegetarian food, mainly the chicken, which the food what is hot, like Ushna Virya Aharas, we have to reduce. So if somebody, and more spicy food also, like spicy food, if you are consuming, and the next day when we go for the defecation, that time it may get some pain and the burning sensation, and also usually the non-vegetarian food, if they are able to live, that is well and good.
Thank you, doctor. So I think spicy, oily foods as well.
Yeah.
I did get a few more comments. Good informative session, Dr. Karthik. Thank you from Ashtanga. That is from our MD. Then we have, thank you, doctor, for the information. Then thank you, doctor, informative session. Thank you, Ashtanga, for arranging such Tadvidya Sambhasha. Yes, doctor, thank you so much. That's from a doctor. This comment is from Dr. Annapurni. Thank you, doctor. So we have a few questions which are anonymous, as I told you earlier. I'll just put them also. Thank you for giving us your time. I know it is very busy schedule that you have, but still a few more questions just for the sake of clearing out. Please tell the difference in all these diseases, how a patient can understand which disease I have.
I can tell you. When you go with the from the piles, I'll start from arches or piles. So it's very difficult for the defecation, maybe blood. Like when you use Indian toilets, now all are using the like Western toilet, no? This toilet, the Indian and the Western toilet, having a major role in the disease. It is one of the main cause of this disease, you know. Like when you are using the Indian toilets, the anal canal, it will come straight. So it's very easy for the stool to pass. When you change to the the Western toilets, it's very difficult. We are in a seating posture, and maybe some of you people used to use mobile or newspaper in the toilet, and our like position also changing, and the anal canal, it's somewhat some abnormalities will come during that process. So it is one of the main cause of the disease. So in piles, we are getting some blood stains. In some bleeding piles, some blood will be there. So you have to look what is that. And in Bhagandara, like fistula, we'll get a mass. Anyway, we'll get a mass outside the somewhere near the buttocks, like an abscess. So we have to go with that. We have to check with the doctor, is it only an abscess or it is a fistula. And in fissure, you will cry more because the fissure is the condition having more pain. Okay, you'll get some when you touch and see, you will get some wound there, and it will pain more.
Skin tag, I think so.
Yeah. Sentinel tag, yeah. In this condition, when you pass the stool, some like line of blood will be there over the stool, and pilonidal sinus already I told, usually it is in the cleft area, so you can figure it out.
Yes, doctor. Thank you. So the next question, doctor, is Shara the final solution? Will the piles recur? Okay, that's a good question.
Yeah. The Shara Sutra we can, when we are doing the Shara Karma, both Shara Sutra also we can do in a pile mass, and Shara Karma also we can do in a pile mass. So it's almost 60 to 70%. It is a final treatment for this condition. And after the treatment also we have to do all the lifestyle modification and all. Then it may won't reoccur.
Yes, I think here I would like to add a comment here. Yes, most of the time the recurrence rate for people who have undergone Shara therapy, it is much lower than the other surgical methods.
Yeah.
So even in the allopathic texts, there is a line, just one line at least they have mentioned Shara Sutra line of treatment. But that itself is a good thing. I think recent books we have noticed this.
Yeah,
so,
yeah, correct. Now all the modern science they are telling, not the certain thread, but they are telling the Shara Sutra.
Yes. So that is also mentioned here. So another question, Shara Sutra treatment, is it better than surgical removal of the tract in fistula? So I think that answer we have already.
More than 90% we are getting result in Shara Sutra than other surgical treatment.
Yes, doctor. So one Ayurvedic doctor gave me medicines of varicose. Is it going to work for piles?
Yeah, correct. Varicose is also a type of piles only. Like because in varicose also the blood is coming and lodging in some veins and it's protruding outside, right? The same thing is happening in the anal region. The blood is coming there and it's protruding and it's making a blood mass. Okay, when the mass itself won't make problem. When the hardened stool and all, it may get problem for the pile mass. So the varicose vein treatment is one of that. The medicine, it can help the piles also.
Thank you, doctor. So I remember our classes in the undergraduation surgery classes. I remember one of our sirs mentioning that piles is actually the varicosity of the anal Ano-Rectal region. So
Yes,
you treat piles with varicose medication. So okay, next question is intake of kashaya completely necessary? Can we do it without kashaya with only capsule or tablets? Okay.
And then this is the same thing I told, no? The patti and all, but I think the pure form of kashaya is more helpful than all other kashaya tablets and all. In my practice, it's like that. I used to give my own kashayas because we are not manufacturing. But in some pharmacies, they are making good kashaya tablets, so you can use. But the dose will vary. Yes. What is the in the raw form? The dose will vary in that condition.
Yes, doctor. So how diagnosis is done in Ayurveda? Is it different from diagnosis of allopathy? Okay.
Both diagnosis is not separate for allopathy and Ayurveda. There is same for allopathy and Ayurveda. All the tests what allopathy people are giving, that test we can also do. The most thing is only the examination. We have to go through the proper channel with the proper doctor, and we have to do the examination, and we can do the treatment.
Yes, doctor. I think I have a comment here. Yes, diagnosis is itself a science. It is not part of Ayurveda or allopathy. or homeopathy or any pathies in general. So diagnosis itself is a science. Diagnosis is not limited to any other science. So diagnosis is an art also. So it can be used by any of these pathies. It can be the same method. It can also have different methods as well. We Ayurvedic doctors learn both the modern method of diagnosis as well as the Ayurvedic method of diagnosis, including pulse diagnosis. So diagnosis is not limited. So next question is, are these surgical methods of Ayurveda allowed by the government and is it practiced widely? If so, please say where.
Okay, it's a good question. Like now the Ayush ministry, now the government is doing more with the Ayush system. So now I think around 33 diseases, surgical diseases can be treated with an Ayurveda doctor who did an M.S, who did some masters in surgery. They can do around 33 conditions. They can do the surgery. And in most of the places, they are doing very good in Sharasutra therapy and all, bites and all. In Bangalore, they are doing. In Hassan, when you go to Bangalore, they are doing. When you come to Kerala also, many doctors, they are doing wonderful practice with the Sharasutra, Sharakarma.
Thank you, doctor. Here I'd like to add.
I don't know about Trichy and Tamil Nadu. Almost these places I know.
Yes. So I'd like to add here the recent government mandate is that it is passed that M.S. degree holders in Ayurveda, like for example Shalya, like Dr. Karthik, and in Shalakya, like myself, and Prasuti Tantra Stri Roga. These are officially MS holders. So they undergo that proper training of doing surgery. So they are allowed to practice surgery. So that is what I'd like to add here. And of course, some states have already allowed the practices earlier itself. Like for example, state government of Karnataka, in some places, northern Karnataka, I think, as well as in Maharashtra, it is allowed. And now I think the whole of India would be allowing it. It's a good thing. We undergo a lot of training and then only we do come into this picture. So the next question is Shankhabhasma not indicated for anorectal disorders as it is Ushna?
But we have to do the Anupana in that condition. Have to take more Takra or some called Shida Vidya as an Anupana, and we can take the Shankhabhasma as a tablet or as it like a Bhasma, you can take it.
Okay. I think the question is based out of Shankhabhasma being a medication for most of the acid reflux diseases and all. And mostly anorectal disorders come associated with this. And
that
when
only,
they get a doubt. Yes, I think that is the end of the question answer session.
Almost all the like Bhasmas, they are Ushnavidya, almost all 90% of. So we have to treat always with the Anupana only.
Yes. So I think that is the end of the question answer session. The feedback form to everyone, I am reminding you, the feedback form is there in the chat box. Please use the feedback form to give feedbacks. Yes, I think Dr. T.V. Naran-Varier is here to ask a question, Dr. Karthik.
Not a question, Dr. Karthik.
Yes, sir.
Can you suggest some, that is 1-2 matters, that is generally we cannot see nowadays only that is Bagandhara or fissures alone. There may be the other diseases along with it, especially for diabetes.
Okay.
Those who are having that is Bagandhara or fissures.
Okay.
What do you suggest? Especially for diabetes, we have to suggest exercise, Vyayama.
Yeah, correct.
While Vyayama, if we are doing Bagandhara, what will happen?
See, when a patient with like diabetes and they are having all the disease, first we have to reduce the diabetes condition, or else the wound won't heal. Like as Sushruta tells, we have to treat it like a wound. Right? So when you want to treat it properly, we have to reduce. We have to first go for the diabetes condition, and then we have to go for the Bagandhara or fissure or fistula, any condition. So at that point, we can have some medication for the symptomatic relief for Bagandhara or fissure. Right?
For those patients, so can you suggest this Charakarma or
If the diabetes, the sugar level is controlled, we can do. Sugar is at a control level.
no problem that is with the Vranas?
No problem. If we are doing the Shara Karma, it's not like a normal treatment. We are doing a Shara. It's something heat therapy, right? Shara also forms a heat. When you go for a cautery, it won't have some more impact on that. So if it is the diabetes, the sugar level is in a normal condition and it is going like that, you can do some procedure.
Can we give any? There is not a guarantee. Suggest that it will not recur. The Gandhara is especially that is after taking that food only.
No. We see all this condition. I can give you 90% guarantee, right? Maybe
Recurrence, because
recurrence may
we have
happen.
met so many patients after 7 or 6 or 7 surgeries.
Yeah. We are getting many patients. Like after maybe some, I got a patient with just telling something with the treatment. I got a patient. The patient is having seven fistula tract. So
Okay.
he used to do some weightlifting or something because of the food what he is taking, like the protein and the whey protein and some steroid, something for the muscle mass and all that he's taking, and he did surgery. First he did surgery, and again after 2 years he came with 7
Same.
other modern hospital, and he came with 7 then I think he took around 1 year for the total cure. Now he's okay. I think it's
Okay.
the 4th year. Now he's okay. Till now,
Okay.
let's see.
Very good. Very good. Okay. Very good. It's okay.
So I think it's mostly Nidana Parivarjana that needs to be done first. And yes, in hospitals like S.D.M. Hassan and I think Amrutha also, surgeries are done after the sugar level of the patient is completely monitored, inpatient levels. And once it is completely under control, the sugar levels, only then the surgeries are, the patients are taken for surgery. With that, I'd like to ask Dr. K.S.Varier to give a few words on today's session.
A very good session you have that is presented, and I hope that those who are present, they have got some ideas. By viewing this, we cannot go straightly do this Charakarma or such kriyas. That only we have to be very careful. After getting a proper training only, we have to do that. This all. Okay, thank you.
Thank you, sir.
Thank you, sir. So I would also like to ask our MD, Dr. K.S.Varier, to give a few words on today's session.
Girish, I am not a doctor. Dr. Karthik, this has been a really, see, I am a layman. I'm one of the very few non-doctors around, I think, in this. Probably Mr. Joe also will be there around, and Nirmala. But I think this is something, Shashi is also there. But I would want the light on audio. I would want this is the first time I'm coming into this kind of knowledge. It's quite scary, Probably you have been probably seeing it every day because you have been trained to treat these people. But touch wood, so far I have not had any such kind of a problems. But it's really a big area where I think you need a lot of medical attention. And I really hope people take care of their diet. And I think that is one of the first things you always advise. I think that's a very important thing, which people normally don't take care. And like what you said, that people always want to eat whatever they want and then just take tablets and get their health back. I think people need to realize that it's not really so. It's very good session, Dr. Karthik. Thank you for you're taking your time.
Thank you, sir.
Yes, so with that, I think we come to the end of this session. Before that,
Mr. Joe could share something with us.
yes, yes, please, sir.
Sorry, sir, I was on mute. I was for the first time listening to a session like this, more out of curiosity. While I've attended a lot of sessions in health, and FCB has got a health division, which where webinars are a common thing. This is the first time I'm going through a webinar for Ayurveda, and I was curious because I wanted to learn a little more. So I think it's a very well articulated and very well session. Thank you, Dr. Karthik. I thought it was quite useful, and a non-doctor like me could understand what the problems were. So I thought it was great. And the answers and the way you've handled this whole session, I thought was very, very interesting.
Thank you, sir.
So from my side, I'd posted a personal question to you.
Yes,
Because
sure.
nothing to do with this. Since you gave me an opportunity to talk, let me make it open.
Sure, sir.
I have asked you a question because I thought, it's Ano-Rectal diseases, something about stomach and things like that. Now all the doctors are here. I wanted to know whether in Ayurveda there is something, is there a management for Hirschsprung's disease? You know the Hirschsprung's disease, correct? Hirschsprung, Hirschsprung's disease.
Hassan diseases. Yeah.
Yes. It is a condition of the stomach where in some part of the smaller intestine or the large intestine, you don't have muscle cells which pushes the excreta out. So the treatment is you need to probably take off that part of the stomach or the intestine, and then probably clip it, and then it is automatic and it has to be managed.
Yeah.
Okay. So I was wondering, have you come across something like that?
Till now, not, sir.
Yeah.
Yeah.
So, and is there a treatment in Ayurveda? Because I thought, there are a lot of doctors here. If any of you have come across something else, I thought, it will help me personally. That is why.
Sir, I'll go through that and I'll get you back through Girish, Dr.
Yeah.
Girish. So I'll work on that.
But overall, I thought it's a great session. I think we need to do more of these, and I think this is what is going to make us probably an authority and expert, and it is going to help all the young doctors come up and make the practice much more even richer and relevant to a larger mass. So I thought it is great. I just sat in because I wanted to know how it is going and wanted to see for myself what are we doing, and how do we take Ayurveda forward. That was my interest. So that is why I sat for the whole thing. Thank you. I thought it was interesting. I learned a lot. Thank you for that.
Thank you, Joe. Thank you.
Thank you, sir. So at last, I would ask Mr. K.S.Varier to give a few words, and we can come to the end of the session.
Like our MD said, it was a very scary session. Like I was also feeling a lot, afraid of many things that were shown and that were to be realized. I had known a few things about these, but then not this much. This seems to be a very, very urgent. There seems to be a very urgent need to correct our diet, and that's very important. I think this is where we need to educate people on the diet. I think the metabolic disorders is one area where we have to concentrate now, and it sure will help our patients at large. So I think all the doctors here would definitely agree that metabolic diseases are some of the commonest diseases that are coming to us, and we have the strength to attend to this. I think we will take this forward and we will learn more about how diet has to be managed, how the whole thing can better our health in all perspectives. Thank you very much, Dr. Karthik, for this very enlightening session. It has been quite an interesting session, and I'm sure all the people who have attended have taken something to take home today, some knowledge to take home today, and they will definitely correct their diet, I'm sure. Thank you.
Thank you.
Thank you, sir. So with that, I would like to formally thank Dr. Karthik for taking his time to give us a bird's eye view onto what anorectal diseases are and how management is done through Ayurveda. It was a wonderful session, Doctor. Thank you so much for being here and giving us this.
Thank you, Girish. Thank you so much.
I would like to thank all the participants who have come here to listen to the session. Thank you all for being present here, and this is a good start for 2021 for Ashtanga, for everybody present here. So with that, I would like to come to an end of this session. Thank you so much. We'll meet again soon in the next month with another great session like this.